So our next step will be locating your nerves. Okay, so how to do that. So this nerve finder comes within the PTU. How to connect all of it, it's pretty simplistic. So there are tags on each wire that correlate with the direction on the nerve finder box. So very simplistic here. We push on. Sometimes that's the biggest problem. Thereafter, this is the ground. Similar to like an EKG sticker, we are going to place this behind the wrist of the patient, to which ear the neurostimulator will sit behind. So we take that plastic off. We'll connect the ground. Untwist the pen. Before that, you need to do a thorough clean behind the patient's ear and on the patient's ear with an alcohol swab, as the nerve locator is very, very sensitive to any makeup or hair oils or skin oils. So let's do that quickly. Just behind the ear where the ground would be, in the front of the ear. And then on this note as well, the nerve finder, that pen that I began to take the cap off of, is very sensitive. So it's very advantageous to do a little alcohol swab after every find of each nerve. Okay, so now I can screw off the pen. As I just mentioned, do a little alcohol prep. And now we can get started. I would have your surgical pen handy, because when you find the nerve, you then have to mark it, right? So that when we come with the cathodes hereafter in a few minutes, it's an easy find. So let's start with the ground, which is behind the patient's earlobe. I'm going to need a little bit more leeway. Thank you. So we'll get back behind in here. I don't know if you can hear the screeching of the nerve locator, but once that occurs and you've found your position, you then use a pen to mark it. Right there, like so. So let that. Thereafter, we can go to the earlobe and find the next 3 locations. As I mentioned, it's just very, very good to give a little alcohol swab on the locator each time. Next, we're going to find, we'll start with the one on the actual ear here. And that's a good one. Mark that one. Kind of. These ones are sometimes a little bit more difficult, but based on the diagnosis, you know, I didn't take my own advice here. I need to do a little swab. All right. Perfect. Sometimes it does take time. I'm getting quite lucky with these nerves, and that's okay. Just takes patience, because ultimately we want to find the right ones. Right? And also just a little bit of experience, you kind of get used to it. And then lastly, I spoke too soon. There we go. Okay. Thank you. Make sure I did not take the other one off. Nope, it's still there. Now next step would be prepping the neurostimulator to then attach the cathodes.